There are several ways to test for Mycoplasma hyopneumoniae, and knowing which method is right for the job is key. In this video, we'll be going over how to take a laryngeal swab on a piglet with the highest level of safety and accuracy. Before diving into how you properly get a sample from the larynx, here is the testing equipment you will need for each piglet. Mini-tip swabs, a mouth gag, and a laryngoscope. Remember, with piglets, to use smaller swabs and a smaller mouth gag, or the proper restraint gear. And for the best chance at a clean sample, make sure you have the following supplies: personal protective equipment, a permanent marker, protective earplugs, disinfectant wipes, a caddy for equipment, a trash bag, storage bags for samples, a cooler, ice packs, a submission form, and mailing and packaging materials. The first step in sampling is identifying what your objective is and the subsequent test group. Once you know that, select a piglet for testing. Depending on your herd size, you will usually test somewhere between 25 and 35 piglets. Hold the piglet tightly under one arm, with your hand under its breastplate between its two legs. Keeping the animal steady will ensure its safety. Once the piglet is under control, insert the smaller-sized mouth gag between its jaws. If you don't have a mouth gag and laryngoscope, use a 1-inch or 2.5 centimeter piece of PVC pipe. Make sure the edges are sanded smooth. Remove the swab from its packaging. There are several different types of swabs, but rayon, like the one we're using today, is ideal, and cotton should not be used. Use the blade of the laryngoscope to see into the back of the piglet's throat. If you don't have a laryngoscope, position piglet under a light source and use a tongue depressor. The epiglottis must go down in order for you to see the larynx opening. When the swab enters the larynx, keep in mind you may hear the piglet's squeal change in pitch. Once you reach the larynx, swab the cartilages that open and close the airway by rotating and sliding the swab up and down and around the larynx. When you remove the swab, check to make sure there's enough mucus on the swab for a good sample. Place swab in tube, close and label it, then place it in a labeled bag. Fill out the submission form for that piglet sample. Before sending the piglet back to its group, mark it as having been sampled. Use disinfecting wipes to clean all tools that will be used on the next group of piglets. Anything that could possibly contaminate the sampling from one piglet to the next must be replaced or cleaned. Once you are finished collecting all your samples, secure the tubes in the cooler with enough ice packs to maintain a temperature between 32 and 40 degrees Fahrenheit, or 0 and 4 degrees Celsius. Secure lid on the cooler with packing tape, include a completed submission form, and the appropriate mailing information. You can view more videos on proper Mycoplasma hyopneumoniae testing in its various forms on the Boehringer Ingelheim Swine Health YouTube page.